Hello, I am Aditi Dubey. Today, let's talk about something we often take for granted until we need it the most: healthcare. Not just doctors or medicines, but the entire system that catches us when we fall. In Europe, that safety net is often called universal healthcare, a promise that no one should face illness alone or go bankrupt because of it. But while the ideal is shared, the reality varies country by country, hospital by hospital, and patient by patient. Let's begin in Germany. Germany's healthcare system is built on a model of statutory health insurance known as gesetzliche Krankenversicherung. Over 90% of Germans are covered through public sickness funds and the remaining through private plans. It's a hybrid system, universal, but with elements of market choice. For cancer patients, this means broad access to specialists, therapies, and cutting edge treatments. Germany has made huge strides in precision oncology, with leading centers in Heidelberg, Berlin, and Munich. But the system isn't without friction. Regional disparities persist, especially in the parts of former East Germany, and patients can face long waits for certain diagnostics, despite the country's wealth. Now, shift your gaze across the channel to the United Kingdom. The National Health Service, or NHS, is one of the world's most iconic examples of fully public healthcare. It provides pre cancer treatment at the point of delivery, from chemotherapy to palliative care. But the NHS is under strain from funding gaps, workforce shortages, and a growing backlog worsened by the pandemic. Cancer survival rates in the UK have improved steadily, but still lag behind some Western European peers, especially for lung and pancreatic cancer. Early diagnosis is a key challenge. Many patients enter the system late, after visiting a GP multiple times. Then there is France. Often ranked among the best healthcare system in the world, France offers a model of solidarity with choice. Public insurance covers the bulk of treatment, and private providers operate within the system. French cancer care is centralized through regional cancer centers, known as CLCCs, which offer comprehensive treatment under one roof: medical, psychological, social. Screening programs are robust, and survival rates for breast and prostate cancer are among Europe's highest. But even in France, disparities creep in, especially for those in rural areas or from migrant backgrounds. And what about Eastern Europe? In countries like Poland, Romania, and Bulgaria, the commitment to universal healthcare exists in law, but implementation tells a different story. Underfunded hospital, shortages of oncologists, and limited access to new cancer drugs all create gaps in care. In some regions, basic diagnostics like PET scans may be unavailable or only found in major cities. As a result, cancer mortality in Eastern Europe remains significantly higher than in West, even when incidence is lower. Late detection, lower health literacy, and out of pocket cost all take a toll. But change is happening. The European Union is pushing for more equity through its Beating Cancer Plan, with investments in screening, registries, and research networks. The cross border healthcare allows patients in some countries to seek treatment abroad with partial reimbursement. Still, the question lingers: does universal coverage mean universal outcomes? Not always, because coverage is only the start. What matters next is quality of infrastructure, of trust, of coordination between hospitals, general practitioners, and community outreach. It's about timely diagnosis, affordable drugs, psychological support, and follow up care, regardless of your postal code. Cancer does not discriminate, but systems can. And the measure of any healthcare system is not how it treats the majority, but how it lifts the most vulnerable: the elderly, the poor, the migrant, the rural patient. If Europe truly believes in universal healthcare, then cancer care must live up to the promise, not just in policy papers, but in hospital wards, clinic waiting rooms, and in the lives of those fighting for one more day. I am Aditi Dubey, and this was episode 11. Thank you for listening.